Hi, my name is Nidhi Sharma. I'm a women's health physical therapist here at FuncPhysio Physical Therapy. Today we're talking about leaking during pregnancy. So if you are in your second trimester of pregnancy or just starting the third trimester, middle of third trimester of pregnancy, and you have started leaking urine. So you either run or jump or pick something heavy or something. If you are doing something really strenuous and you leak a little bit of pee, that is new to you during pregnancy. What are the implications of that? A lot of women think that it's normal to leak in the pregnancy because the idea is that the bladder, the uterus is so big, the baby is pushing on the bladder, and that's why you're leaking. In second trimester and even the beginning of third, the uterus usually is not that big that it mechanically pushes on the bladder all the time. So even though your uterus is bigger than what it was and your pelvis has also gotten bigger, so there is more space in there to accommodate the uterus. So this early in pregnancy, you should not be having mechanical pressure on the bladder. So contrary to the popular belief, the leaking earlier in the pregnancy is not due to pressure on the bladder. It often is due to your poor posture. So what we find typically in pregnancy is that as the belly gets bigger, women tend to give into that weight and start to lean back and sort of stand with your pelvis forward. This position of pelvis makes it very hard for you to use the pelvic floor muscles that support your bladder. It also makes it very easy for the uterus to push on the bladder. If you were more neutral here and your abdominals were working, it is unlikely that the uterus is going to push on the bladder in second trimester or early third trimester. So it is also very important to know that women who start leaking earlier in the pregnancy, second trimester, earlier third trimester, are much more likely to leak 6 months or 1 year after the pregnancy. So research shows that women who start leaking earlier in pregnancy tend to leak much later in the postpartum period because it is likely that you either don't know how to use your pelvic floor muscles, you don't know how to use your abdominal muscles, or that you're trying to do a Kegel, you're trying to contract those muscles, but you're actually pushing down on them. That is quite common. So it is important at this point in pregnancy to come see a physical therapist. We can strengthen these muscles. So see, these muscles of pelvic floor have gotten looser, have gotten bigger. The abdominals have gotten looser, have gotten bigger, but there still is enough tone in these muscles that we can strengthen them and train them to come back and usually reduce or eliminate your symptoms. Depending on when you come in to PT, how far you are along the pregnancy, either we can eliminate these symptoms or at least reduce them. Only time there is mechanical pressure on the bladder is probably last 2-3 weeks before you give birth. Every time before that has some component of poor pelvic control. It also has some component of baby being too big or you're gaining more weight than your doctor wants to. So healthy weight control is important. But coming in for pelvic floor physical therapy at this time is ideal also because you will learn how to use these muscles properly for 6 to 8 weeks after giving birth when you're so busy with the baby that you can't get to PT. So it will teach you and prepare you to take care of yourself in those 2 months after giving birth, which are very, very important to get back your strength. Okay, so if you're leaking in second pregnancy, come see a physical therapist. Whether it's second trimester, third trimester, any time before 2-3 weeks before giving birth, you should come in and get checked for that leaking. Hope that helps.